Hey, Tony,
Yes.
we want to go ahead and kick this off.
Yeah. How many we have on? Oh, we got 12 people right now. Okay. All right. Well, it's 5 minutes after 5. My name is Tony Soriano. I'm the Director at Large and Program Chair of IFMA Orange County Chapter. I've been a member of IFMA for 28 years and also a member of the Orange County, Los Angeles, San Fernando Valley, San Diego, and Inland Empire. Thank you for joining us today for our meeting. We have, as we all have heard, June 15th is the target date for reopening facilities and everything that we have now here in California. And today we have a very informative panel presentation. And our topic is the long and short of facilities strategy for COVID workplace reopening. As we all know, here in the past year, COVID-19 has been an outbreak, and what's taken place now as we start to move into reopening is the catalyst for change and for reiteration. The need to pay attention to how facilities are being managed and serviced as we move forward to the post-COVID opening facility. All building environments, whether they're owned or leased, corporate facilities, educational institutions, warehouse, manufacturing, all of these different facilities need to have careful consideration and tailored plans for reopening. As you have seen in our flyers, we've got 4 folks that will be talking about it. Each one of them have different facility experience. So I want to turn this over now to Jennifer Corbett-Shramo. She will be acting as our moderator and will introduce our panelists. Jennifer?
Thanks, Jerry. Good afternoon, everyone, and welcome, fellow IFMA members.
You're on mute.
Let's start that one again. Good afternoon, everyone, and welcome to the IFMA May meeting. My name is Jennifer Corbett-Shramo, and I will be, as Tony said, facilitating this afternoon. I believe our program, which Tony has kind of given you a brief on already, will be informative, insightful, and filled with tremendous amount of timely information. Each of our speakers will provide a summary of how they operated their organizations through the pandemic during the past 15 months and how they're planning to navigate through the reentry of their employees and workplace operations in the coming months. All the speakers, as Tony mentioned, come from vastly different organizations, from aerospace to healthcare to large event centers. So the information should be shared today will be very diverse, hopefully comprehensive, and we just really look forward to you being able to garner lots of data from our meeting today. At this time, it's a very honor for me to introduce Speaker Fernando Vivero. Fernando is the Director of Facilities and Plant Operations and Site Lead for Aerojet Rocketdyne's Los Angeles, California facility. As the Director of Facilities and Plant Operations, he's responsible for executing all the CapEx projects and ensuring the site's infrastructure, lands, buildings, and equipment are all operational to meet the company commitments to product delivery, quality, and cost. As the site lead, he's responsible for ensuring the site achieves all of the company business unit objectives, complies with policies, procedures, and regulatory requirements, all while creating a safe and positive team environment. They're in alignment with Aerojet Rocketdyne values. Fernando began his career as a test engineer with Grumman Corporation in Bethpage, New York. And in 1988, he joined Aerojet Rocketdyne and has held various positions within engineering, program management, facilities, and operations during his 33-year career with the company. He holds a Bachelor in Science in Engineering from Hofstra University in New York and a Master of Business Administration from Pepperdine University right here in California. He's a recipient of the Boeing President's Award, the Leadership Excellence Award, and the San Fernando Valley Engineering Council Award, along with he's a 2-time recipient of the Rotary Club Paul Harris Award for his volunteer services. Please welcome Fernando Rivero.
Thank you, Jennifer. Can you hear me well now? Okay. So thank you for the introduction. As Jennifer said, I work for Aerojet Rocketdyne. It's a space and defense rocket engine manufacturer. We're actually across the United States. We have various sites, the largest site being the one here in LA in Chatsworth. I'm the general manager, so I get to see all the different pieces of running a business. This site population is about 1,500 employees and contract labor, so it's quite large. And we have manufacturing, processing equipment that is unique, one kind of single kind in the world. And the things that we make are very unique in themselves. You probably remember back in the early 60s, the first astronaut to launch into space, when we went to the moon, the space shuttle, all our space defense systems, the Peacekeeper, the THAAD systems. We just landed in Mars. All those programs were either launched by us, taken off the ground, or actually gotten into the moon or landed on Mars. And the rover that is right now in Mars is being powered by one of our systems. So we've had a long history of kind of firsts and very complex kind of products that we manufacture. The reason why I'm giving you a little bit of this background is because it's one of those industries where by design we are very risk averse. We have to understand risk, and not that you scurry the issues and the risk, but that you understand them and that you plan appropriately. So risk management is in our DNA, just by the nature of the work that we do. So it's prudent risk management, really, what it comes down to, and understanding where your exposure is. So when we got into this COVID situation, we quickly reacted. Like I said, we have 1,500 employees, commitments to our space and defense customers. So there's, the world did not stop for us. We had to continue. So quickly we enacted our pandemic response team action plan, which honestly, we actually ended up having to toss it and start all over again, because the world that we were working in COVID was a lot different than what we had ever imagined we would be participating and working under. So we identified our essential employees, those who could not work remotely, and we had those working on site, obviously, and then everybody else worked remotely. But it was a constant learning process as we went through this. And that's what was important is, like I said, we are a risk-averse organization, but we also are understanding that learning is important, and not being afraid to change is important. So as the pandemic was evolving and the situation around us was changing, we had to evolve and we had to quickly respond, because in reality, our customers, whether we're going to Mars or up in space, those missions were still going. They were not stopping. So we had to continue doing what we had to do. So we enacted a 4-stage level of controlling our safety of our employees. So we went to stage 3, and basically that said anybody who absolutely had to be on site could only work on site. Everybody else worked remotely. So that accounted for about 400 or so employees that were on site. The rest were remote. So we had to go and create all the IT infrastructure and improve on what we had, so that the rest of the employees could be able to, support the organization. It was a 24/7 operating environment. So now we had to maintain that as well. So the throttling down to the minimum was really critical. So, you know, I tell you all of this because, again, it's, you know, it's in our DNA. But now we got into a situation where we are working on site and remote, and we have to turn our thought process into a different type of management style, if you will. And I think of it in this way, you know, I have kids when they were young, when they were very little, you told them what to do. And as they grew up and they matured and they learned, they did things because they wanted to do it. And I think that's kind of the differentiator here, is creating an environment where people do the right thing because they want to do it rather than being told. So, you know, when we decided that we were going to open up, June 15 is coming, we've done incremental openings of the site. Right now we're close to 800 employees on site. So we increased almost, you know, by 400 over the last several months. But how do you get those others that have been working for over a year that haven't stepped into the plant for the last 15 months? How do you get them back here without telling them that they have to be back here? So we are looking at a program that basically creates that environment that makes the employee want to come back, right, rather than being told. We have all the safety protocols in place. With Jennifer's help, she's done a tremendous job to keep us safe. So now we have to ensure that the people that are going to be coming back are safe and that they feel safe. And if they don't feel safe, what is it that we're need to do for them to create that environment? So, you know, we got to reconnect with those remote working employees, and then connect to kind of the bigger picture. You know, appeal to the fact that this is not just about us. We're actually supporting our nation with major programs that are going to the moon. Eventually, we're going to go to Mars. We just landed in Mars with a rover. So it's more than just a very small product that we're delivering. It's a larger service and thing that unites us to move forward. So how do we create that sense of belonging? How do we create that sense of community? Is where we're going, so that I can hopefully have the employees say, hey, I really want to come back. You don't have to tell me to come back. I want to come back because I'm missing out on all the camaraderie that comes in and doing what we do. So we created in the beginning 4 groups, the group A, B, C, and D. Group A's were those that were essential, that had to be here. Group B's were those that could work, come in temporarily, but could also be effectively working at home. Group C's could work effectively and don't have to come in. And then Group D's were those that had special needs, children in school or situations that were COVID related that caused them to having to work. So now we're back, you know, working in reverse. And by going to stage 2, which is the next lower level, we're actually promoting to bring the Group B employees in. And so we know that not everybody's going to want to come back, and not everybody needs to come back, which plays in a lot of and provides us advantages and as well as disadvantages. But so we created a flex work plan that allows you, from policy procedure, to be able to work remotely or to have an alternating working schedule. And, you know, how do you give the employees that have been out the sense that they're safe? Well, we've been doing this now for 15 months. We've had over 400 employees working here and had very few cases, none except for one, that were internally COVID cases. Everything was brought from the outside. So now we've created an environment and a working situation where it is safe for everybody. So again, it's critical to create that want to come back, that it's okay. Hey, jump in the pool with us. It's all right. We got it all sorted out. And obviously there was a lot of calories that were burned to get to that stage. But I think we're there, and we're slowly moving into that situation. So what are we doing to create that environment here locally? We're a large company. We have our own supplies, masks, sanitizers, the cleaning with Jennifer's help. It really creates an environment that is safe. So that excuse is taken away. Because I think in some situations, it's removing those excuses that it is okay to come back to work. We had a vaccine clinic that we offered this week. So now, and that was open not only to employees as well as to their dependents. So again, how do we help them feel safe? We've created plexiglass dividers with 3D printed brackets that were unique to each situation, and those we're printing and designing them in-house, so we can turn them around in 15 minutes. We'll make a set of brackets so we can accommodate any situation that you may have. And so we're preserving a lot of the cleaning protocols that we've put in place. And we understand that there's going to be employees who don't want to come back in. And so those workspaces are going to be converted to hoteling touchdown points. And we're going to be setting up a reservation process. Just like you want to reserve a conference room, you can go and reserve a touchdown space. So when you know that you're going to be coming in on Tuesday, you can reserve a space to go in, and you have a place to connect, and you have everything you need, and then somebody else can reserve it. So that allows us to, then it clears a lot of the floor space so that we can spread employees out and we don't get clustering, which is a problem that we have to work through. So the other aspects is we've done, like everybody, we've done the cleaning, but we also provided the employees personal as well as room filtration systems so that they feel safe and they have the peace of mind that they need to be able to work in. So I think the kind of the bottom line here is you got to show visible actions. They got to be data driven. We are a very data driven company. The number of cases that we track and report on, we report on a daily basis, send out a daily report to everybody, how many are in quarantine, how many have tested positive, and so on and so forth. So we're open, and people understand where we are. So from a long-term standpoint, we are prepared with IT. We have an infrastructure that we've improved on so people can work remotely. We are identifying those employees who will always be working remotely, so then this way we can repurpose those office spaces that they currently use so that we can have touchdown points in the hoteling. And then, the policies and procedures become very important because people, if they want to work here, they have to follow policy and procedures. They cannot be told this and then to another employee something different. It has to be a consistent message. So, we're thinking that all these steps that we've taken to keep us safe the past 15 months, plus all these added incentives to create an environment where people want to come back and feel that they're going to miss out, it'll give that, I want to go to work, I want to be on site. We're going to be looking at setting up drive-in movies so the employees can bring their families and kids in. On June 14th, we're having open week for diversity and inclusion. Again, it's intended to create that sense of community. Share fairs, car shows, cook-offs, all those things were planned for late in the quarter so that slowly people feel like they can come back and it is safe. Because I think bottom line is people need to be told that they're going to be safe. That's the number one priority. And also lift and remove the excuse for those that use that as an excuse that I don't feel safe. That's what I wanted to share with you. And it's a constant learning, like I mentioned before. We'll adjust. We're not afraid to change if things don't work out. Thank you.
Thank you so much, Fernando, for your insight and sharing your program with us. At this time, I would like to introduce our second speaker, Andrew or Drew Basilio. Andrew is the Manager of Manufacturing and Facility Engineering for Avantis in Irvine. He has worked in the medical industry for the last 11 years. And he started working in research and development, but then transferred into operations and manufacturing engineering side back in 2014. Since 2014, Andrew has been in charge of several facility upgrades, moves, validations across 3 separate different companies, and he's led successful validations and carries a positive can-do attitude. Andrew is a graduate of UC San Diego in bioengineering, and when Andrew isn't working, he enjoys spending time with his wife and 9-month-old baby boy. Think about that age and think about COVID and what he's been through in the last year. Let us all now welcome Andrew.
Jennifer, yes, having a child and navigating COVID at the same time was very interesting. It was not something I would recommend if possible to anyone. I wouldn't want to do it again with all the COVID related issues that came about, obviously, around the baby once he was born and everyone wanting to see him. So I'll just go over what our Return to Work Safely program here at Avantis. So we're a medical device manufacturer. And can I get this to change? Okay, so our product is called the Hydrus Microset. It's about the size of an eyelash. And what it does is it restores the eye's natural fluid pathway to reduce pressure. Now, glaucoma is a group of eye disorders that lead to the damage of the optic nerve, which leads to vision loss or complete blindness. Glaucoma is a leading cause of irreversible blindness in the United States and the world. Over 3 million Americans have it, majority of which are 40 or older, and it's known as open angle glaucoma, which is what we're approved to help reduce the pressure of. In 2020, there's about 80 million people that have glaucoma worldwide, and that's expected to increase to over 111 million by 2040. So as you can see, it's a very niche market, but we feel that it's a great market to be in right now as glaucoma impacts almost everybody. It also costs the US economy $2.86 billion every year. And yeah, so it's that small on that finger, and it's actually even smaller than that picture. So as you can imagine, we lose it quite a bit. So we started our product release in the middle to end of 2018 and sold about 2 million. The next year, we were up at 26 million, and that ranked at about #2 in history amongst venture capitalist-backed med devices after a 1-year initial launch. In 2020, we were on track to be #1, and then COVID hit. And since we are an elective surgery, COVID shut that down since it wasn't an emergency type of surgery, and no device was hit harder than our space, which is MIGS, known as minimally invasive glaucoma surgery. So how did we come back from this? We really wanted to use our company goals as a blueprint to help draft our COVID strategy. So we did that by keeping our awesome team intact. We got cash, we saved cash, we came out stronger, And most importantly, we had no staff reductions, which we're very, very happy about. So our big focuses on our company strategy are science, which you'll see over the next couple of slides, integrity. And so we gave no BS. We were honest and transparent with all of our employees, and talent. We wanted to keep our team engaged and focused during this downtime where we weren't producing as much as we could have been. So we took that time to really implement lean processes, process improvements, cross-training, and really just focus on being ready for anything that COVID gave us. So our number one safety goal was to keep employees safe and make employees feel safe. We wanted our employees to come into work knowing that this place was safer than Lowe's, Costco, Trader Joe's, or any of the other places that were open during the pandemic. We wanted to make them feel safe coming to work. So we had different employee groups. For essential personnel, we kept everyone in-house through the pandemic. We never had a shutdown. Just like Fernando was saying, we couldn't afford to shut down. We needed to keep making these devices for when the world opened back up. So everyone in manufacturing, quality control, the warehouse, engineering support, we were in-house every day trying to make our processes better or fix any issues that we had now that we had the downtime. Additional support personnel were on hybrid remote, so they were coming in 2 days a week, 3 days a week, and working the rest from home. And for the field-based employees, where they actually couldn't get into doctor's offices or ORs, we focused on getting them N95, sanitizer, any type of PPE that any hospital or doctor's office would require. We wanted to be able to provide that to them, so when everything opened up, they could hit the ground running and go straight with it. We had open communication to all of our employees, honesty and education. We gave them the rundown. Okay, we're going to do this, and this is how we're going to do it. We're having a salary reduction so that no one has to get cut. Here's what it is. Managers took this much, floor staff took this much, and we were very transparent with everything we did. We leveraged technology as much as we could. I'll go over those in the next couple of slides. And contact tracing protocols. Whenever we had someone test positive, we asked them who they were near, and they said, oh, I was near so-and-so. We talked to them and said, okay, this person tested positive for COVID, go get a test and don't come back until it's negative. And we're proud to say that we had 0 cases of transmission at work. We did have several findings on a Sunday evening or Sunday morning. That was fun to navigate through, and Jennifer's team was super helpful in getting that through. So common themes with the rest of the world, you guys have all seen this: masks in all common areas, social distancing. We had these automatic hand sanitizers that we placed at the beginning of each entrance. These HEPA filtration units on the right, we place these in the office areas. Because we are a medical device manufacturer, we do have a clean room, and so that room is HEPA filtered. So that room wasn't impacted whatsoever, but we wanted the employees in the cubicles to feel safe, and so we put these extra HEPA filters throughout the building. We have a daily temperature check, so you come in, check your temperature. And we have an app called One Medical, and that's actually a daily health check-in. So it asks you the general COVID questions. Do you have a fever? Do you have a stomach ache? Do you have chills? Do you have diarrhea? Do you have, it's a list of questions you have to answer each day. And it takes that list, sends it to HR so they know this person doesn't have it. And if you have one of the symptoms, someone will call you from One Medical and ask you how you feel. So that was really helpful in also doing COVID testing. They provided quick turnaround COVID testing, and they became a vaccination site as well after the vaccines became available. We also implemented green dots throughout the building. So in our lunch areas, we put green dots that signified 6 feet. So someone wouldn't have to be worrying, oh, am I 6 feet apart? Oh, I'm just sitting at a green dot. Great. This is 6 feet from the next person sitting at a green dot. So we did that in our office areas, our lunch rooms, and our we also did plexiglass partitions. I'm sure similar to what Fernando did. We didn't have a 3D printer, so we paid a pretty penny for brackets when they were a hot commodity. I don't ever want to pay that price again for 2 pieces of metal that get sandwiched together on maybe what used to be a $5 piece of plexiglass. We provide lunch for our employees every Monday, and that used to be buffet style. You'd go up, you'd fill your plate up with food, and we ended up changing that into a box lunch, which actually made cleanup and made sure everyone got the same amount of food each time. So you didn't have one person packing their plate on and a few people didn't have any food later. Some of our key vendor partnerships, ICS, I mentioned earlier, they really provided state-of-the-art practices. I remember back in February, their director came in and said, Andrew, I have this cleaner to help combat the coronavirus. And I said, well, Angel, we're not going to need that. Coronavirus isn't a thing. And sure enough, a month later, I'm glad he had brought that in, and they were so proactive in providing sanitizer and cleaning services available to us. They updated their practices to have daily disinfection for all touch points. And they were able to do deep clean and disinfection on demand. One of the instances I was talking about earlier was we found out of a positive case on Father's Day. So I had to make the call to Angel, who I know is a father, and say, hey, we need the facility cleaned tonight so everyone can be back Monday morning. I gave him a call at about 10 a.m., 11 a.m. He called me back, said, Andrew, we'll get it done. We got you going. They've been very flexible and very communicative. The other one is One Medical. So it kind of talked about this earlier, online check-ins, quick turnaround, easy COVID testing, vaccination site, and it was free to all employees and household members. So did we come out stronger? As you can see from this graph, we were on a trajectory from end of August, dipped down in 20, but now we're back up and hopefully we'll be on top soon. So the long-term outlook, we're going to continue to maintain the mask mandate in coordination with local and state regulations. Just waiting for California and OSHA to catch up with the CDC guidelines, although it sounds like June 15th will be that day. We're going to continue to provide vaccination information and the ability to take time off, employer paid, if you want to get the vaccine. Also, if you have any symptoms, we're providing paid time off after that second shot if you have any of the symptoms that people experience. Fortunately for us, we don't have any required facility restructure. Employees may continue to work at home pending your department requirements, and we've increased the night cleaning to 3 times a week. So based off of all this, we do feel comfortable that bringing everyone back is going to be fine. A lot of people have been back. A lot of people never left. So for us, it's been a fun journey. Adding fatherhood to all that has been a journey in itself. So thank you very much.
Thank you, Andrew, so much. That was great. I really appreciate that. And that supplier partner of yours sounds really cool that they actually will allow family members participate in that program. That's very cool. We might want to add that link or send that out to other organizations. At this time, I'd like to introduce our final speaker, our fearless Jerry Eldridge. Jerry is the current chapter president of the Orange County chapter, and he is the director of facilities with the Orange County Fair and Event Center. He's worked in the building industry for over 30 years, and early in his career, he started through the trades and became a superintendent until he opened his own general contractor company, where he spent the next 10 years building a commercial and residential project organization. In 1994, we didn't have a pandemic, but we did have the Northridge earthquake, and Jerry spent 2 years assisting FEMA as a building inspector for the city of San Fernando, evaluating the structural integrity of homes and buildings damaged by the earthquake. After leaving the city of San Fernando, he completed 10 years in the production home building industry as a project manager. And now he's landed and he's been at the Orange County Fairgrounds and Event Center for the last 13 years as the facility director. Please welcome Jerry. Take it away.
Thank you very much, everyone, and thank you all for attending. So we are an event center. We We produce over 170 events a year. We self-produce an annual fair with 1.4 million patrons in a 23-day period. So as you can imagine, we're pretty busy here every day. I get a lot of questions. People are like, oh, you work at the fairgrounds. What do you do when the fair's not there? We do a lot. We have 64 buildings, 152 acres. We're a pretty good established facility here. However, in March of 2019, we went from having all these events and a great, robust plan for the future to having 0 events, canceling everything for the year, and losing $18 million in 2019. And we knew that going in April when we canceled everything, that we were going to have this major loss. So not only were we trying to figure out how to keep our staff safe, but we also had to figure out how to recover at the same time of trying to get everybody safe and then get everybody back to work so that we could move forward. So I'm gonna just kind of scan through here. I'm gonna kind of take you from where we were and to where we are now. So hang in there. March 2019, our facility was shut down. In April of 2019, our management team created a task force to help establish protocols on how to basically survive, you know, kind of like Fernando was saying, we had a couple of different tiers on when, you know, when it got bad. Actually in April, we went from having about 20, I think we had about maybe 45 people on grounds, because in March we sent a bunch home. But in April we went total red, and I ended up carrying 6 guys just through this process. So the recovery, the task force put together protocols, and we put together COVID-19 policies. We put together training materials, standard operating procedures, health screening, and risk assessment documents. And so the highlighted bullet points are the only ones I'm going to read. I'm not going to read them all for the sake of time, but there are numerous things that the state had told us before we can bring people back that they wanted to see, particularly, actually not the state, but particularly the Orange County Health Department said, if you're going to bring people back, you need to have a COVID employee policy. We needed a return to work standard operating procedures. The risk assessment and protection implementation plan and an attestation form. Each department had to have an attestation document written. So the admin building had to have one, our farm had to have one, the creative services had to have one, maintenance had to have one, event operations had to have one. Every single department had to have one written, created, and this was our protocols on cleaning. It was our protocols on breaks, how many employees you're going to have. It basically just said how every single department's going to run during COVID, and that's where we're at with that one. We also had to have an event specifics to the every event that came in that wanted to have an event here. They had to give us their policies. We had to have COVID protocol for them, and then we had to send that over to the health agency, and they had to approve it as well. Our HR department reported all the COVID cases as a state agency. We had to actually report them to the state. So anytime we had somebody who got ill, we sent it up to the state. I don't know if that was the same with other private companies, so I'll just say that it was state because that's all I know. But I know that it was reported. It went out to everybody. They did the tracking, making sure, you know, anybody was contact tracing, and make sure that everybody stayed home when need be, which hurt a lot because when we dropped down to only 9 guys, you know, it was pretty critical because as we've heard before, we went to who's important to be here and then who has to be here. And so I'll get to that in a moment. So where we started, sorry, I've lost track here. So we went from 120 employees full-time down to 20. We have farm staff that actually couldn't go home, you know. You got animals, you got to feed them. We actually had we had a couple people in the farm get COVID, so we had to take maintenance guys, bring them from home and send them over to the farm to keep the animals fed, to keep the pens cleaned, and just to stay on track. At that point, we weren't even turning on water. We weren't even working, doing maintenance. We were just feeding animals and sending everybody home afterwards. As we planning staff changes. So in June, we started bringing everybody back, and staff changes. As the team increased in sizes, we had to establish not only different break areas, but to separate the teams. So as we started getting bigger and bringing people in, even at the administration offices, now we're like, okay, well, we have a room, outdoor room that can seat 25 people. Where are they all going to go? So we had to separate those guys. Our facility layout, we went in our restrooms, we reduced the capacity by closing urinals, stalls, and sinks, and making it so that the opportunity to use to overpopulate the restrooms, we had to reduce all the restrooms access. In the office spaces, we put arrows on the floors, so we were able to encourage traffic flow, so we didn't have cross traffic, which happens, you know, all the time and generally in a office space, but we had to make sure everybody was walking in a circular motion and not going back and forth. We also installed plexiglass in between the cubicles as well as reducing the space. So if you have a cubicle of 4, we just only allow 2 right now. That's where we're at. With our face coverings for our outdoor spaces, for the Orange County Health Agency, we've been given permission to gather with 3 or less without face coverings, as long as all 3 of you have been vaccinated. However, if 4 of you are together and you're all been vaccinated, you still have to put a face mask on. So, you know, as we've all been trying to work through, you know, the processes here, it's been tough to manage through what's expected. In indoor office spaces, we are looking at, if you have your own office, you can be unmasked, but as soon as somebody comes in, you have to put a mask on, vaccinated or not. And if you walk out of your office into common space, then you have to put your mask on as well. So those restrictions have not been lifted at all. Changes to how we clean. We've increased quite a bit more high touch surfaces. We've provided staff with hand sanitizers. We put hand sanitizers touches outside of every office door. We continue to provide more robust cleaning. You know, I think that's helped with the flu, because I don't know anybody that's had the flu in our company this year, in the last year. And equipment that we've used, we use electrostatic foggers to disperse the, actually the bottom is the disinfectant that we use. It's a hypochlorous acid, which is a medium, it's a pH of about 5 to 6. It's super great for a product to use, and we've been putting in electrostatic sprayers. We've been using the ozone sprayers. I have a thermal fogger, and it's been really productive for us to use this product and to disperse it how we have. With the COVID, I'm running out of time, so I'm trying to hurry up. So I'm going to skip. We've been had the opportunity to apply for a GBAC, Global Biorisk Advisory Council. And this is an accreditation that establishes facilities and infectious disease prevention work practices to control risk. So they take a look at all the documentation, all the practices and everything that we do as far as cleaning, how we procure products, how our staff is trained. They look at all of our processes and our protocols and cleaning, and they evaluate that. And through that evaluation, they give us an certification, the GBAC Star accreditation, which then allows us to advertise that as a safe and healthy environment for our public. And that's it. I did wanted to talk about today. We had a great opportunity. We partnered with Yamaha, and they brought out a helicopter drone. And with this drone, they sprayed our amphitheater with the hypochlorous acid and showed us a demonstration on how they use this helicopter to crop dust vineyards and grape vineyards up north. And they wanted to show us how they can use it to disinfect stadiums and coliseums. So they used our facility as a trial to see how it worked. And we've got some pictures we'll show you of that in the end here. But I thank you all for being a part of this, and hopefully you can have some good questions for us. Thank you, Jennifer. And stop sharing.
As we conclude, excuse me, as we conclude the speaker portion of our program, I really wanted to say thank you to all of our presenters for taking the time. I know you're busy. It was very generous of you to participate in this meeting. And for that, our chapter is extremely grateful. At this time, I'd like to draw your attention to the final, or actually the second to the final slide of today's meeting, and that is of Jerry's drone experience. And Tony, if you want to pop in, you can explain what's happening here.
Sure thing. Sorry, just got to unmute myself. There's a lot of difference in opening facilities. Yamaha, we put together a program for outdoor venues, things like the stadiums, ballparks, entertainment centers. And this is what they've come up with to spray and to disinfect the steam seating. So if you've never seen this before, it's a drone that's actually 7.5, 8 feet long, and it has pods on each side carrying about 8 gallons of fluid. And what they use these for right now is up in the wine country, up in Napa and Sonoma, for getting rid of the bugs off of those. There's 5,000 of these worldwide, and they use them for rice paddies, use them for cornfields. It's one of the ways that they can maneuver into tight areas. If you look at how the grape vineyards are, they're sideways on a hill. You've got natural trees growing all around them. So you need to come in and program the helicopter to go through all of the ways of going around it. So it's what they call mapping. They had to map this and take a look at the stadium beforehand so they can fly at a particular level of effectiveness. So that's the concept, and that was what we did today out in Jerry's Pacific Amphitheater.
Thanks, Tony.
Any questions? Yeah. Go ahead.
Yeah, we're not quite, we have one more slide. We just wanted to pull up, and this slide will be distributed to all the attendees today. And these have references for legal questions you might ask. Fisher & Phillips is a law firm, and they provide information on how employers should be returning to work. Every CDC, state, local, um, um, entity is published or listed here. So if you want to see what's happening in Orange County, San Fernando or LA County, Orange County, then there's some links to the cleaning industry has published or recently provided a documentation for facility managers. There's that very vital end list of disinfectants for the coronavirus. So it helps you search if you're using the right virus fighters. Then there's a link to GBAC that Jerry talked about. And so I think that these links should prove to be very helpful if you haven't or you're continuing to develop your reentry programs. And with that, I think I'll turn it back to Tony. We'll go for questions.
Okay, any questions from the attendees out there? Again, there's some valuable information depending upon what kind of facilities that you operate. I think that any question here can be directed to our speakers. And I'll just give you a moment there in the chat box. If you wouldn't mind putting your questions there, we'll go ahead and ask those questions.
Tony, I think this is a pretty quiet group we've got here. Oh, we've got a question. Perfect. Hi there. I'm Jennifer, and Tony's been knocked off his computer. So go ahead and ask your question and I'll direct it to the speaker.
You mind if I just ask my question verbally instead of in the chat?
That'd be perfect.
Yeah, that'd be great.
So a lot of people that we service, or a lot of the accounts that we service, I do pest control. A lot of people have noticed an influx of bugs all over the place, especially in their communities. And I don't know if they're noticing that because they're just home more or because there's a lot less activity going on outside where they feel they need to hide. I'm curious to know if the offices having been a little more empty during the pandemic, has that shown kind of like the bugs and things like that being a little more bold, showing their face? Because there's a couple of buildings I can think of that you'd see cockroaches in areas where you wouldn't have normally seen them. And that's just because the offices have been empty.
I can talk to that. You know, we've got food in a lot of different spaces. And with, it was almost like we had a semi-rapture here. You know, everybody went in March, everybody just left. So it wasn't like, you know, we came to work and we said, hey, in a week, we're going to be leaving. So everybody clean your desks, everybody clean up and clean your spaces. It was, hey, go home tomorrow. So when we started opening up buildings and getting back to work, I mean, it was bad. We've got rabbit, which is funny. We've got a rabbit infestation over at the farm that is out of control. And I think because we don't have as many people on grounds constantly disrupting, you know, the activity, they've had a field day. Same with I think the pests, you know, Orkins try to stay up on it, but you know, they weren't always here because we weren't allowing them on ground. So I think with the services, as you were saying, people just weren't keeping up. So now it's a little out of control and you guys are rolling in there trying to save the world on all these pests and everything getting out of control. So that's how I see it for us.
Can you imagine how much worse it would be if rabbits weren't such great breeders? I mean,
Okay, it looks like we have a question from Tom Harkenrider. He would like to know, has anyone participated in the UL program for healthy building certification?
Well, this is Jerry. I have not. I read into that, and what I have done is I've talked to a member of IFMA, Joshua with Diversified, and I spoke with him. I actually spoke to several different companies before I met up with Josh, but to talk about indoor health quality, air quality, and right now for us, the GBAC is our main goal. And once we establish that, and we can start having, more confidence in our community as well as our employees, then we are in the process of looking into the UL part. But that's a good question, because I am looking into it. I just haven't got enough information that says pull the trigger.
Tom, I have a customer, Canon USA, corporate headquarters are in New York, and they did a fair amount of research on a UL program. And I can put you in touch with the director of national facilities, and you can talk to him about it. They had basically what I've been advised of. They had some very big concerns with regards to the safety of the individuals and the cost of the equipment. But I'd be more than happy to put you in touch with Joe Randazzo out of New York with Canon.
I'll yell and scream, and maybe you can cover for me.
I think that's it. It's 6:01. And again, I wanted to thank everybody for your participation today. I'm hopeful that there was some learning by everyone. I know I learned some things. And I'd just like to say, again, we're grateful for everybody's participation. And we'll see you next month. Take care.
See y'all. Thank you.
All right, thank you.
All right.
Thank you. Have a great, safe weekend.